Thank you, sir, and thank you, APAO and the entire Translational Research Committee for giving me this opportunity to share our work, where I'm going to talk about markers to mapping a road to personalized medicine. So there are various diseases we come across and deal with every day, but one of the most common diseases is dry eye, which is multifactorial, and it can impact the quality of life. And at this point of time, an average of 60% of the patients across the world do suffer from dry eye in a mild, moderate, or severe way. Now, we do come across these patients every now and there, where the first set of patients, when we treat them based on your Schirmer's, T-BUT, and tear film metrics, they respond to the treatment, and they're quite happy. However, the second group of patients, they're not happy with the first line of management, and then they start seeking opinions from different doctors. And after multiple opinions and different treatment regimens, they're still unhappy with what they are doing or what treatment they're getting. So we are moving towards a world where we see quite significantly a lot of non-responders in our practice to the initial treatment, where they may have persistent or worsening symptoms with the initial treatment, and that's when they don't respond. So what we do right now currently, some of the times it's like generalized medicine. It's like one size fits all, where whenever you have a specific condition, you give a specific treatment. But we are moving towards a world of personalized medicine, where we have to have diagnostic tests in terms of biomarker analysis or lifestyle analysis or diagnostic tests specific to each patient, and based on what a combination of these tests tell you, you have to decide what treatment to give rather than one size fits all. And that would probably reduce your amount of non-responders or patients with serious adverse events to your treatment. Now, the time has come that we do identify the non-responders, and probably will need advanced diagnostic modalities for a customized approach. So what do we need? Probably it's a biomarker. A biomarker is nothing but any imaging or molecular biomarker which can be found in your blood, other body fluids or tissues that is a sign of normal or abnormal process or a condition or disease. And the biomarkers can help to predict the disease. It can help to see whether this is safe or not. It can help to diagnose the disease. It can help to monitor whether your treatment is working or not. And it will also tell you whether this specific biomarker has a potential or a very high risk to a certain condition or a certain eye as well. So when we started preserving all the samples which we technically remove and discard during the surgery, like tears during your dry eye test, blood serum, vitreous, lenticules during your smile surgeries, aqueous during your cataract surgeries, and epithelium during your PRK or cross-linking surgeries. We started collecting all those samples in this Eppendorf tube and started storing them in our repository. And whenever we wanted to find an answer to a particular question, we used to remove them and do probably a molecular factor analysis using a flow cytometry or a qPCR to find the answers. But we all know that it's quite every clinician cannot have it in the clinic, so we wanted to develop something which every clinician can use in the clinic, and that's why we have developed this BioM Pathfinder kit, where in your clinic, along with your Schirmer strip or aqueous or vitreous, you can measure 8 biomarkers at this point of time, which is an ELISA-based kit, where it's a microfluidic device where you just add the samples in the cartridge, and at the end of 90 minutes, you get a report. So just a demo of how the test is done. This is for tears for any ocular surface condition. We collect a Schirmer's tube at the end of 5 minutes, like how we do a dry eye test. We add a patented buffer solution in the tube and then shake it for 5 minutes for the protein to be eluted. And then at the end of 5 minutes, we take 5 microliters of the solution, put it in the cartridge, and put it in this device. At the end of 90 minutes, we get this detailed reports, and our journey has now come to an AI-based report, where based on a combination of these 8 biomarkers, for each of the right and left eye, we will come to know whether it's healthy, whether there is subclinical inflammation or inflammation present. And this is based on AI, so it takes into consideration the combination of all these 8 biomarkers. Now, what biomarkers we have chosen? We have chosen a combination of inflammatory and non-inflammatory biomarkers, and we have also chosen biomarkers which can be used for your dry eye patients, your keratoconus patients, if you're a retina surgeon, it can help in your ARMD and diabetic retinopathy or vascular occlusion treatments, and it can also help in your ROP babies as well. So that's why this combination of treatment, so that this kit can be used as a multi-purpose kit by an entire institution or clinic. And as I mentioned that the report does tells us whether this is normal or abnormal. How does it help us in clinics? We do have a variety of biomarkers. So if there is only one biomarker which is on the higher side, based on what levels, whether it's one-fold high, two-fold high, or three-fold high, you can customize and titrate the treatment based on the severity. If it's ICAM1, you can add a lifitegrast to the patient's treatment at the first line of management so that there are lesser incidence of non-responders. If it's a combination of biomarkers, then you can think of an IPL or a vector pulsation therapy along with lubricants and try to avoid steroids as much as possible to avoid unnecessary complications. And this is what we do for our dry eye disease patients and keratoconus patients. ROP babies, it's quite tough to see these babies, what they suffer, especially the premature babies, and sometimes you do have to wait to see whether the disease is going to progress or not. So taking a step further, we use this biomarker kit to predict that whether a particular ROP baby is going to progress or not at the first visit itself, and we titrate the treatment, whether that will need an anti-VEGF or not, and whether the baby will need a laser, and that's how it helps us in ROP as well, based on the VEGF values. Now, as mentioned before, this kit is not just for dry eye or keratoconus, but it can be used for many other unhappy patients, vascular occlusions, retinal conditions, myopia, and glaucoma, and that is something what is our aim. The future would be that the myopia is on rise, and we do know that sometimes we cannot predict whether which patient is going to have a progressive myopia or which patient is going to have a non-progressive myopia, and whether your treatment is going to work or not. So a very important biomarker which is associated with the progression of myopia is dopamine. If your dopamine levels are on the lower side, these patients are more prone to have mild or moderate or high myopia. And if it's on the lower side, it can keep increasing as well. So the dopamine level here is the key, and it will also help us to identify the customized treatment or frame a treatment for these patients based on the dopamine levels and what we do and what best drug would be there. It also, based on the tau protein, it also helps us to predict whether a particular Alzheimer's patient, what is going to be the path of it, whether a particular patient is going to develop Alzheimer's or not, and if yes, then how fast is going to progress is what this kit can tell us and help us to predict. Now, when it comes to keratoconus or any post-refractive surgery ectasia case, we don't know that why some patients stay stable and some patients do progress over time. So we are moving towards an era of imaging as well, and in keratoconus the key is in collagen imaging, but at this point of time the collagen imaging can only be done when we extract the corneal tissue and do some gene expression analysis. But is there a non-invasive way? Yes, the non-invasive way would be polarization sensitive OCT, which helps us to measure the collagen orientation and the Bowman's layer thickness, like this map. If you see here, the darker the blue color or violet the color in the center, that means your density of the collagen is quite good for this particular patient. And if you see certain patterns, like how the collagen fibril orientation is, then you know that this is a healthy eye. But if this is disrupted, then you see more yellow or red colors in the periphery. And it also gives you, the PSOCT also gives you the Bowman's layer thickness, a thick Bowman's membrane which is above 15 microns. That means this patient has a less risk of developing ectasia or going into ectasia post-refractive surgery. However, if it's a patchy Bowman's layer, like you see an area of thick Bowman's layer and a thin Bowman's layer, this patient, if you have to perform a refractive surgery on this patient, then this patient is at a high risk of developing ectasia. So PSOCT will help in doing this because it can come in a permutation and combination of that, and based on that you can decide the surgery for your refractive surgery patients. So we are moving towards an era of personalized medicine. All of us do try to give the best way where we can give a personalized approach based on biomarkers or imaging modalities, and I think we just have to enhance our diagnostic modalities as we go on with time to give a personalized approach. Thank you.
Thank you very much. I think we can have time for questions. One question. Do you have any questions? Yeah.
Sir, at this point of time, as soon as we get the approvals, hopefully in January 2026, it will be commercially available. January 2026. For now, yes, sir, because we have an in-house kit available, so we can do the test and give the report. Thank you.
Okay. Thank you very much.